Now's the time to finally realize we the people must make some choices. If we want single-payer health care, now's the time to raise our voices till they hear us in the halls of Congress and behind the White House door that we're sick and tired of getting sold out and won't take it anymore.
We'll work on that.
Alright, so I'm just going to drive home a few points that Rose already made about what single-payer is and what single-payer isn't, so that you can continue those conversations with folks that need a little deeper understanding of what we're talking about here. So, you will get these slides, I won't read them to you, but single-payer is publicly financed, right? We're taking the insurance, the private equity, out of our healthcare. It's publicly financed. It's efficient, it's effective. It is a way to provide health equity in a way that really does not foundationally exist in our current healthcare process, right? You can't take a tiered, profit-driven system and turn it into an equitable healthcare landscape, right? So this single payer provides a foundation for health equity that does not exist in our current healthcare lack of a system, right? It puts you and your provider back in the center of your healthcare. The choices that you're making are yours. They're yours, they're based on what your provider and you decide that you need, and they're not driven by your health insurance plan or the choices that your provider has made on your behalf, the choices your insurance company has limited you to, those kinds of things. And only when everyone has the same access to care will everyone's care be affordable, accessible, and high quality. We can't even talk about quality when we're dribbling in access right now. We're cutting hairs on who has access to what. So think about that from a health aspect. This slide I stole from the League of Women Voters. We've been using it all over the state as we've been doing town halls to talk about single payer because it's very important that you inoculate yourself against the misleading ads that are going to come. There is a ton of money. It's our money, but there's a ton of money that's going to be lost in profits by these insurance companies, by the big pharmaceutical companies when we can negotiate drug prices and those kinds of things. So you have to think about what single payer isn't. It isn't a public option. It isn't Medicare for some. It's not Medicare Advantage. We talked about why it's not Medicare Advantage. It's not managed care. It's not socialized medicine. These aren't government-run programs. We're not hiring doctors and nurses, although we do that in this country, in the VA, right? We do that. But this is not that. It's not government-run. So think about, because these are the talking points that have been used against us for decades, right? They're well ingrained into the minutia. So I'm going to hand it back over.
Just one comment?
Yeah, absolutely.
I think it's important to clarify one thing, which is that the single-payer advocates, both at the state level and the federal level, are not proposing to get rid of the Veterans Administration healthcare system, nor the Indian Health Service and the tribal programs.
Right.
So those will continue alongside the single-payer program for everybody else. And that's something that's clear in both the Senate and the House Medicare for All bills.
Perfect. Yes.
I'm not going to read these either, but I think you can see where our brain was at when we started this. The idea of just getting together, breaking bread together, right? We're going to have a meeting here about 12:30, right? In the meantime, meeting in person, building personal relationship, working together helps build a personal relationship. Right? So the more that we can do that, the more we can kind of get out of our own silos and work together towards a common goal of getting this thing done, whatever those steps and stones are. So, and the idea when it gets all done is that we're going to, again, walk out with action plans. What are we going to do? How are we going to work together to get this thing done? Our first thought about this was, we have to get labor involved, right? How are we going to get labor involved? And we called Rose for ideas. We had a great speaker to go out. So thank you again for traveling out here. It's all at her own expense, and she's in. She's all in. I really like that. The next step that we're going to do here is talk about the different organizations. Who's going first?
Nathan Rodkey, Washington CAN, Healthcare Campaign Director. I'll try to keep this short so we can catch up on time. Like the general elevator speech goes, we're the state's oldest and largest grassroots organization. We work on healthcare justice, immigrants for equity, Mass liberation is what we call it, but it's basically fighting mass incarceration, housing justice, all of those issues. But I feel like in this space, I was thinking about it, I was like, I kind of want to just talk about the organizational structure, because I want people to actually kind of know how we function and what makes us who we are. My title is Healthcare Campaign Director. I still work in the phone canvas. I still do fundraising calls. I still help manage the phone canvas when I'm not the co-chair of Healthcare's Human Rights Steering Committee. I came through the canvas. Our organization, the thing that really makes us, I don't want to say unique, but definitely makes us stand out, not just in the state, but across the country, is that it's the synergy of our phone, field, canvases, and our program team. Our program organizing manager, John Godfrey, is over there. John came through both the field and then the phone canvas before he got onto our program team. I spent a decade helping work in the phone canvas and then helping lead it before transitioning into my role at Healthcare as a Human Right. But through building out our canvas, we're able to go out into communities, have lots of conversations with people, and I feel like I've canvassed maybe 30% of this room. Not even joking. I've talked to them on the phone, just doing fundraising calls. And when people donate on a healthcare issue, they're buying in. They are investing in the issue. So that's one of the things that makes us unique, because we can also train our teams to listen when they're at the doors. If somebody, why are you donating tonight? Why are you donating today? Because I have a story. Because there's something that's happened in my life that makes this issue really important to me. And then we connect them with John or another person of the program team and develop them into being able to share that story in a space where they can really move that issue. So, our program team is incredible. The synergy with our phone and field canvas is why I think we're here and why we have a good reason to be here. So am I also introducing healthcare as a human right? Because I can skip right into that. All right, so as the... Oh, yeah, thank you. There we go. That's our vision. Yep. Our mission. The slides will be available later. All right, healthcare is a human right. The state's largest coalition working towards universal health care. It is a community and labor coalition. Much like working at Washington Can, the thing I love about working with healthcare is a human right is I get to see this amazing cross-section of people who show up for the healthcare justice movement. And no matter if the day is good or bad, I always have that at the end of the day, that I got to be with all of you. So I really love that about it. I would say the thing we do best is right now the thing we're effective in terms of doing is helping move incremental legislation that works along the list that are on the Rose shared about getting at all those points. That's the thing you can get done on a yearly basis. Stuff rises up. You get a large cross-section of organizations to push the momentum, and you can make the dominoes fall and make those changes occur. We, as an organization of over 38 organizations, as a coalition of 38 organizations, we have a good number of labor organizations that are on the list. But I got to be really real about it. And David Loud, Claude, Jim can speak to this. It's not from lack of effort. We work our double snakes off to get labor to be not just on the list, but at the table. And we don't have labor at the table the way we need it. And that is a lot of our work right now. But for those that are at the table, man, there's no shade on them. Really proud to work with everybody. So, yeah, that's kind of the crux of it. And I hope I'm short on time. Yeah, great.
Thank you, Neesland. Yes. Next, positions for National Healthcare Program.
Thanks, Butch.
Hi, my name is Hugh Foy, and I'm a retired general surgeon. I've worked my entire 45-year career in the public sector, last 27 years at Harborview, doing general surgery, or as I say sometimes, the 11 o'clock news every 6th night. I'm also the product of the last system of indentured servitude in the United States, which is residency training. It was part of the 1980 strike that closed Harborview down, or at least slowed it down for 2 days to get better working conditions. So, Physicians for a National Health Program is an organization that is nationwide. It has over 25,000 members. You don't have to be a physician to be a member of PNHP. Our local chapter was started about 18 years ago when Quentin Young, who many of you know is a longtime advocate of human rights. He was one of the initial members of Medical Committee for Human Rights in the Civil Rights Movement, challenged David McClanahan and I on a familiarization tour to Cuba. Says, why don't you guys do something up in Washington State? You're a pretty progressive community. So David, Erica Goldstein, and myself put together our local chapter. We've been going with monthly meetings ever since. We have an annual public meeting, and again, our monthly meetings are open to everyone. And our main focus is a single-payer organization of our healthcare environment, and I never say system because we do not have a system in this country. We have the last vestige of the gold rush, which is, you know, grab every nickel on the table that you can scratch up. So we've had a lot of great national speakers. You'll recognize many of those people. And David McClanahan was instrumental in helping Pramila Jayapal with her bill as well. So our current priorities, again, we're trying to build our organization from the bottom because we're a bunch of retired physicians, because current practicing providers don't have the time due to a lot of different factors. And why can't you see your doctor within 3 months? Don't get me started, but I have a whole hour talk on that. We're supporting our students to come to our monthly meetings. We now have them on our board, and we sponsor them to go to our national PNHP meeting, which we'll do again this year. Last year we had 6 students from Washington State, medical students, to go to our national meeting. We want to educate the public mostly about what single payer and, more importantly and more currently, is the dangers of Medicare Advantage. And if you go on our national website, there are white papers there. The first thing I'll say that is the bankruptcy studies that were done in this country that show that the #1 cause is medical debt. Those were done by PNHP founding members through the Harvard School of Public Health. We've also had a white paper on the damage of Medicare Advantage, and also a follow-up of the financial and personal impact, or the harms report, that Medicare Advantage has done. We also lobby our local and state and national legislators, and we're involved with SBUHCA as well. These are some of those studies that I mentioned. Again, you can get them on our website. We're here to help solidify and increase our network so that we have a unified voice, so we can meet Adam Smith's challenge. It's why don't you all get together and then come talk to me? And we've sat around the table with him, and hopefully we can get his attention to join in. Here's our websites. Look us up, pnhpwashington.org, and PNHP Washington Gmail is our email. And again, you're all welcome to our monthly meetings.
Wow, it's so cool to be here. Hey everybody, you guys are all awesome. My name is Simon Hutton. I'm here with Mike Huntington, who many of you know is a rock star. It's so great to be here with him. We're both members of one-payer states, and also part of a local group in Oregon called Mid-Valley Healthcare Advocates. I'm a communications director. And my work, I'm focused in on how we can build coalitions, how we can use new media, and traditional media, everything from tabling to TikTok to get people involved. I'm here to talk a little bit about us. So we're a community-based organization out of Oregon's Mid-Willamette Valley. So that's like Corvallis, Oregon State, go Beavers. And we're up there, and we're in there between sort of Eugene and Portland in that area. And our mission is to establish a publicly funded, comprehensive, equitable, and affordable healthcare system for all people, and of course in the United States, because what we all want, as Rose said, was we're all working for the same thing, national system, whether we have to get there all at once or through the states. Let's see. So here are some things that we have done. I'm going to focus in, since we're trying to get through on time, I'm going to focus in on the bottom of this. Most recently, we passed a Senate bill that established a task force that basically released a report on a publicly funded universal health care system recommendations. And most recently in 2023, we helped pass legislation, this was Senate Bill 1089, to establish a governance board, which is working on a universal health plan to propose to the state legislature by 2026. So that's where a lot of our focus is going right now. And these are our current priorities. This is the work we're doing in Oregon. We are currently, working to support the health plan governance board to produce, high quality, single payer. We want to make sure it's single payer. Plan for Oregon, including focusing in on what some people, this is a struggle and sometimes hard, difficult to look at, is detailed and fair financing models for that, public outreach with both traditional and new media. That's kind of my department. Build cross-organizational and interstate coalitions, because we're stronger together. Sometimes it's easy to get focused in on our own little, tunnel vision, but if we take a little bit of time to work together, in the long run, we can, have more success, build more power together. So our hopes today on that theme is to build relationships, get to meet everyone here, see what we can do to help each other, find where our goals intersect, how we can support each other in our different, all our different issues. Obviously, we're healthcare focused here, but a lot of different social justice issues intersect in different ways. I really believe that we can find ways to collaborate, even if we don't necessarily agree on every point. Establish communication, build coalition, and share knowledge and resources so every one of our organizations don't have to reinvent the wheel. We can find ways that we don't all have to be doing the same work in our own little bubbles. We can figure out how we can support each other and build a, rising tide lifts all boats. I think you mentioned that before. So that's us, and I think I have, here's our information, contact at mvhca.org, and our website is mvhca.org, conveniently, the same thing. And thank you, it's so great to be here.
Thank you, Simon.
Hello, everyone. Thanks for having me here today. I'm the Executive Director of Whole Washington. My name is Andre Stackhouse, but you can see that we have a wonderful leadership team. Huge shout out to Carrie for doing a ton of the lift on this event. And you might notice treasurer seeking applicants. So in case anyone's interested, hit me up. So Whole Washington was founded in 2016. And it's a 501c4 political nonprofit, and of course we are advocates for state and federal universal health care. One of our sort of unofficial slogans lately has been "by bill or by ballot." We believe that the initiative may be an important part of this process. And our healthcare policy, which has been introduced in both legislation and initiative form, is called the Washington Health Trust. And we've presented to our own Universal Healthcare Commission 3 times on the design of that. You can see all of those on our website. It was difficult to kind of boil down to a simple story, so I left it at this. We are a volunteer-led movement of Washingtonians, united behind the shared policy goal of statewide universal public health care, and who believe it is likely ultimately necessary to take this issue to the ballot in order to achieve I just want to throw in an extra little shout out that if there is a core to this movement, it is nurses. They have represented a huge amount of the file work that goes into this. So our current priorities and our sort of strategies and work have become quite expansive over the years. So we have been running town halls all over the state this summer, and we are hoping to take that to university campuses this fall. In terms of our sort of legislative goals over the next biennium, well, we had been very hopeful that SJM 8006, which is in fact a non-binding resolution, was going to pass in the last session, and we're really a bit upset that it didn't make it through, but we consider this something of a bare minimum. If we can't get this through our legislature, why are we even having these conversations? What are we talking about? Sure, yeah, it's basically a request to start the federal waiver process that would allow us to integrate federal programs like Medicare. We're looking to establish some of that public infrastructure that I think Rose went over quite beautifully. So our public sector health plans, have been said, we think are an acceptable sort of starting point. We want to see a Medicaid deprivatization effort really gain some momentum. And we want to see enrollment beginning to open up to the public. But ultimately, we're looking to pass the Washington Health Trust, and that is a full single-payer statewide system, fully publicly funded and administered, no point-of-service costs, creates that employer mandate to really get employers participating in this system and can cover all minors. And we believe that with sufficient buy-in from wonderful organizations like those who may be represented here today, we can get this on the ballot by 2026, or perhaps make some serious progress legislatively. So for today, we're hoping to grow the coalition, ensure labor has a voice at the table. I promise I didn't get any extra cheating from Rose ahead of this. We really want to see us unite behind shared legislation. It's not our legislation at whole Washington, but belongs to all of us. And then have a clear plan for the next biennium. And we just always need to maintain, because we kind of are the standard bearers here, but to at least keep the ballot initiative in the conversation as a valid strategy looking forward. So we're online, we got email, we're on most social media, we got some events coming up, and you can sign to pledge our next initiative at wholewashington.org/pledge. So thank you.
Yeah. We're looking for more volunteers to tell stories and have conversations at those town halls that we've been having. Yeah.
Lots of good opportunities. Who's next? Healthcare for All.
So my name is Cello. My full name is Consuelo Echeverria, but everybody calls me Cello because Consuelo Echeverria is a hell of a mouthful. So I'm a volunteer with Healthcare for All Washington. Healthcare for All Washington has the distinction of being the oldest grassroots organization in Washington state devoted to single-payer universal healthcare. Since 1994, we have been fighting for this. I'm not going to read the vision. Everybody can read it. But the most important thing about our vision is that it guides our legislation, because ultimately we work and develop and support legislation. So our vision is, the legislation that we support is guided by these ideas of building foundational, as Sherry always says, I love this, foundational legislation for universal health care. So in terms of that, in 2024, this is foundational legislation. We were successful in getting funding for a study to consolidate PEB, SEB, and Medicaid. Was it Medicaid or Cascade? Okay, Medicaid. Which is really important because we have to be able to prove to the federal government to be able to apply for the SBUHCA waiver that we have the capacity to run our own health care system. So that was very important. Then the other things that we do, because we do believe that people shouldn't suffer unnecessarily, is that we support legislation and studies that bring in those that were dropped from the pandemic rule, the 500,000 folks in Washington state who are now without health insurance, how to bring them back into the health insurance system, and also how to cover those that are in the gap because they make too much money to be able to be covered by Medicaid. You see, this is how fucked up this
Yeah,
system
right, I know,
is.
yeah,
I wasn't brought up in this country, and it's so complicated that I don't know. One's for poor folks, one's for old folks, one's for this, it's like, it's ridiculous. The other thing in 2023 that we were, excuse my crappy language, in 2023 we were very excited that we were able to get funding for staff and for actuarial studies for the Universal Healthcare Commission. We will be asking for support to make sure that that funding is actually being utilized by the Universal Healthcare Commission. And historically, Healthcare for All Washington helped lay the groundwork for the development of the Universal Healthcare Commission. Our current priorities are to work with state, national, and local agencies to advance universal healthcare in Washington State, and to develop and advocate for new legislation that prepares for the transition to universal health care. Our hope today is that we will be able to develop our networks and support legislative efforts across the board. And I have 1 minute left, and I think everyone can read that. We have a wonderful Facebook page. Come check us out. We've got great graphics. We have a really very vital communication section, which we're all really proud of, and our website is healthcareforallwashington.org.
Thank you. You bet. Last but not least on this list, Puget Sound Advocates for Retirement Act. Come on up.
Okay, good morning, or good afternoon. I'm kind of excited to be here. I know a lot of the folks in the room have been working on parallel tracks with PSARA. I'm Mike Andrew, I'm the Executive Director of PSARA. I hope that some of the ideas that we've been working on will also be useful to everybody in the room. When we talk about universal single-payer health care, we frame it a lot of the time as Medicare for all, or improved Medicare for all, because obviously we need hearing, vision, dental benefits, we need an out-of-pocket cap, and so on. So in the course of working on this, we realized that there's a serious threat to Medicare as an institution. And that is the threat of privatization. And that threat not only undermines Medicare, but it also undermines our work on universal single payer because it guts our model, right? Because who, apart from insurance company execs, is going to campaign for universal private insurance for all? Nobody, right? So, when we look at the Medicare landscape, we see this disturbing trend. And that is, private Medicare Advantage plans are coming to dominate the Medicare insurance market. A couple years ago, 2023, a majority, for the first time, a majority of Medicare beneficiaries were enrolled in private insurance plans. And that's a problem for a couple different reasons. On the political side, it's a problem because our opponents are going to say, well, people lack confidence in publicly financed health care. They're choosing to go with private plans, right? On the financial side, private insurance drains the Medicare trust fund for the benefit of private insurance companies. Systematic overcharging acts as a subsidy to these private insurers, allowing them to offer lower upfront costs and some additional benefits that traditional Medicare doesn't offer. So, we know the problems that come with private insurance plans. Why do people choose them over traditional Medicare? And there's only one answer, and that answer is price. Price. Because these private insurers get backdoor subsidies. Medicare can't compete with them in upfront price. So that means that if Medicare beneficiaries, traditional Medicare beneficiaries, want complete coverage, they need to buy Medicare plans. And those in themselves are sold by private insurance companies. And depending on the health of the individual, they might really be prohibitively expensive. And, you know, Medicare Advantage, these private insurers specifically target low and middle income seniors and communities of color to market their products. So that brings us back to square one. What do we need to do to level the playing field between traditional Medicare and private plans? Because we want Medicare beneficiaries to be able to choose not on the basis of what's good for their pocketbook, but on the basis of what's best for their health. So when we use the phrase level the playing field, we mean adding at the very least vision, dental, and hearing to traditional Medicare, establishing a very low out-of-pocket cost to eliminate the need for Medigap plans, and financing these additional benefits through clawing back some of the money we're currently overpaying to private insurers. So, how do we do that? PSARA is a grassroots organization, and we have many veteran activists among our members. So one of our tactics is direct in-the-street actions along with some of our local allies like Washington CAN, Healthcare is a Human Right Washington, Healthcare for All Washington. This is one of our rallies. Also, PSARA is affiliated with the Washington State Labor Council, with King County Central Labor Council, and soon will be affiliated also with Pierce County Central Labor Council.
Nice.
Our members include current labor leaders, retired labor leaders, and we are able to use those deep connections with our local labor movements to get labor bodies to pass resolutions and take a stand with us on the issue of leveling the playing field. You'll see a couple of the resolutions that we've passed at the Washington State Labor Council in your packets today. We also devote a lot of time and energy to education. This last slide is a primer we've developed on leveling the playing field. I think they're in your swag bags. If not, there's more over on the front table here. A few of the slides that we've used in this presentation are part of the slideshow that we've developed to take out to primarily communities of color in the South Puget Sound area. So that's another educational vehicle we use. I've put business cards over on the literature table there. Please take one. We're always excited to hear from other organizations and other individuals who have ideas on how PSARA and you can work together in the future. So thank you.
We identified 4 different topics that we're going to look at. It's kind of strategizing around. What kind of people or influential people, right, the 4 we want to talk about. And then primary targets. And the way that this instrument talks about targets is that targets aren't institutions, targets are people. That whole idea of having conversations with people and then targeting influential people to have those conversations with. So who would they be? So part of your job this afternoon is helping to discuss like who would those targets be, and then what tactics would you use to do it. I love seeing the public displays. We're kind of happy about like die-ins. I don't know if you've ever seen any of those where like the people that have died from the lack of health care and representing them from laying on the floor. And the doctor workers are going to the insurance companies. I would have participated in that one myself, but nobody asked me. No one asked me. That's fun stuff. So as you look at that, we have 4 areas, and they show of hands kind of like, I want to see if we got a distribution at all. The first one is the SBUHCA, the state-based universal health care. How many of you are planning on kind of joining in that conversation. Organizing for universal healthcare plans that meets labor's needs, kind of like that involvement in the labor conversation. The 2025 legislative session, single payer in Washington State, level the playing field, to save our Medicare from total privatization.
And the food again, Black Bottle is providing our food today as an in-kind donation, so part of the movement. Really appreciate it. Yes.